Okay, this is a CAT scan looking through the upper abdomen. And I know y'all don't learn how to read CAT scans, and you probably don't need to, but it's kind of neat from an anatomic position as to how these things work. Have I told you my story about John Lennon and CAT scans?
Oh yeah.
When I was an intern and I was working on neurosurgery, it was kind of at the end of the Vietnam War, and we had a whole bunch of guys that had been shot in the head at Bethesda, and most of them were not doing very well, but they stayed there for month after month after month. And one guy got worse, and the chief of neurosurgery said, "Sessions, get an ambulance and take that guy across to the NIH, the National Institute of Health, which is right across the street from Bethesda Naval Hospital, where I trained and worked for 7 years." And I said, "Yes, sir," and I got a couple of nurses and a couple of techs, and we loaded this guy up who was totally comatose, and took him over there for a CAT scan of his head. And it was in the very early days of CAT scans. In fact, the NIH, we didn't have a CAT scanner at Bethesda, at the big Navy hospital, 1,000 beds, but they did. They had 9 of them across the street. Only trouble was out of the 9, only 1 of them would fit a human. The other 8 were made for monkeys and chimpanzees, because they were doing all this research and trying to figure out how these machines worked and what use they were and so forth. So we took him into this one machine, and it was a huge machine and monstrous. And you fit his head up into this kind of gel-filled cap, and this big machine would shoot a picture, and then it was really slow. It took about 20 minutes for each cut to get one picture, and I think we stayed there and got 5 cuts. We brought these pictures back, and they were amazing. They were amazingly clear for the age. Anyway, this was called an EMI scanner, EMI, and EMI scanners were the first CAT scans available anywhere in the world, and EMI stood for Electronic Music Incorporated. That was the Beatles Corporation. And Lennon and these guys came up with these crazy ideas. They were probably on drugs when they came up with them, but that's okay, because they were amazing ideas. And so the first CAT scanners were EMI scanners. Then GE and Toshiba bought into it, and over the last 40 years, that was in 1979, things have gotten a lot better. Out in the Dalles, before I retired, so back in 2001, you could take a patient, put them in a CAT scanner, and they could go from head to toe. Every half a centimeter, it would make a picture of a perfect slice in about 35 seconds. So the speed on the machines and the speed of computering had gone up incredible in that 30 years since I did my first ever CT scan. So this is a CT scan through the upper abdomen, and does anybody see anything they might recognize?
Vertebrae?
What?
Vertebrae?
Yeah, here's a vertebrae back here. So this means right in this little hole here lives what?
Spinal cord.
Spinal cord, sure. What are these white things out here?
Ribs.
Those are the ribs. And you see, remember your ribs kind of go at this angle, so when you take a straight cut, you cut through a bunch of them. And so what's this muscle up here in front called? Rectus abdominis, yeah. And this would probably be like the serratus anterior muscles back here at the chest wall, going up to the scapula. We're below the scapula, obviously. This little funky looking thing here is the diaphragm. That's the diaphragm right there. And here's the other diaphragm right there. So we're right near the bottom of the diaphragm. This is above the diaphragm back here. So this dark area, which means air, that's in the pleural space or in the chest cavity. Whereas on the other side up here, it's in the abdominal cavity. Think about how the diaphragms kind of are shaped. It makes more sense. This is the aorta back here, aorta vena cava combo right there. This is the stomach. The stomach is full of air. That's the black from here up is air in the stomach. This white stuff is called gastrographin. It's water soluble as opposed to barium, which you don't ever want to give to anybody that's been in a trauma because the barium can leak out into their abdomen and that's a disaster. Just cleaning it out, it's pretty hard. But gastrographin is water soluble, it washes right out. So they gave this patient a glass full of gastrographin before they put him in the scanner. And from this you can tell that he doesn't have a hole in his stomach. There's no tear because there's no gastrographin leaking out here into the abdomen. So this is the right side over here. This is the left side over here. What's this big organ here? Liver, right. Liver on the right, spleen on the left. And so here's the liver, and you notice that normally the liver would go right up here against the abdominal wall. You guys have seen that in your cats. You know, there's not really any space between the liver and abdominal wall, but this has got about an inch of space here, or more. It's fluid, it's grayish. That's blood. Blood in the abdomen right there, quite a bit of it. This is the spleen over here. The spleen is actually normally about this size. This one's kind of irregular looking. His spleen is totally crunched and broken into pieces actually. And this is blood around the spleen. There's even more blood over here on this side around the spleen. So this diagnosis here is ruptured spleen from trauma. And this guy needs an operation really quick to stop the bleeding and take his spleen out. We're going to be talking about the spleen a fair amount today. A bad story I can tell is once upon a time when I was an intern, when I was still a medical student, we were operating on this guy and these two residents were doing the surgery. I was just down on the end of the table holding retractors. And one guy said, you know, it looks to me like that spleen's been bleeding. And the other guy picked up a knife and stabbed the spleen with a knife. And he said, yep, it's bleeding. We better take it out. They just wanted to practice taking a spleen out. And back in the early 70s, that was like, okay, because you don't need your spleen. That's what we all thought. And it wasn't until about the 80s that we figured out that, wait a minute, you do need your spleen. Your spleen protects you against infections. And patients were dying it's called post-splenectomy infections. There's a number of them. Most of them are streptococcal kind of things. And so you really do need your spleen. And they took that one out. That was about the worst case of malpractice I ever saw. But what did I know? I was still just a medical student. Anyway, I doubt y'all will ever see anything quite like that in your lives. That's a ruptured spleen with a hemoperitoneum, oral contrast in the stomach, and all that other stuff we talked about. All right, so we're going to talk about the lymphoid system today. This is the last chapter of 232. Basically it deals with how does our body fight infections of different types. And pathogens, that's a nice word to know. Pathogens means small organisms that cause disease. Okay, in other words, patho means pathology or something abnormal. And the pathogens are the ones that generate those problems or are the genesis of those pathologies. And they are things like viruses, bacteria, funguses, and parasites. All four of these different things attack our body in different ways, and because of that, our body has different ways of fighting it. And we have two lines of defense that we use, our body uses to fight infection. One is called non-specific defense mechanisms. And actually, these are the things that fight off most of our problems. The second one is the specific defense mechanisms. These are the magic bullets that we use, which is really the immune system, which is most of what we're going to be talking about here today. It involves things like antibodies, lymphocytes. It involves things like immunizations and so forth that allow us to build up immunity to lots of different diseases. But let's talk for a minute about the first and second line of defense. These are rather non-specific, as it says right there in the red bar. And they are the most important defense mechanism that we have in our bodies is our skin, because our skin just doesn't let things get in, okay? And the skin, the mucous membranes inside of our mouth doesn't just let bacteria crawl in and get into our body in that manner. And a lot of the secretions of the skin, the sweat and so forth, allow us to fight off things before they even really get into us. The second line of defense is also non-specific, but we have all of these white cells. You remember the segmented neutrophils, the monocytes, the eosinophils, and so forth. They are all phagocytic, which means they come around and eat stuff up. There are some antimicrobial proteins. We'll talk about them a little bit. And the third thing here is the inflammatory response. And if I could talk to you about the inflammatory response, I would sum it up like this. Inflammatory response is a very non-specific defense mechanism. And we use inflammation to fight every single thing that happens to our body. For example, if you get hit on the hand really hard, you will have an inflammatory response to that. It will get red, it'll get warm, white cells will pour in there as if there might be some problem, and that's what inflammation is. Remember though that it's non-specific, and so it occurs in basically every injury. If you get a splinter in your hand, then the same thing's going to happen. It's going to get red, it's going to swell, it's going to get warm because it's going to send more blood there to help fight it off. If you can't fight off the splinter, which you probably can't, it will develop pus around it. It'll develop a little pus cavity, a little abscess. Pus is nothing but white cells, just lots of white cells and bacteria living in a little pocket there. And it's very hard for the body to fight off things if it can't get into the pus cavity. So in general, pus has to be drained. And I think of all the principles in surgery, that was probably the number one principle. If you had pus in there, you had to go drain it, or the patient wasn't going to get better. That's interesting. Oh, okay. What are the functions of the lymphatic system? I was being really clever once upon a time. So as we talk about the lymphatic system, it's another entirely different circulatory system. We've talked about the blood system, which is arteries going out and veins coming back. Now we're going to talk about the lymphatic system, which is just another set of little vessels that run all through your body. And their functions are, number one, to drain excess interstitial fluid. And they also transport things, especially dietary lipids. You guys haven't had digestive system yet, but in the wall of the intestines there are lots of these little lymphatic vessels that actually pull the fat directly out of your intestine, directly into the lymphatic tubules. And because of that reason we call them lacteals. Lacteals means white, as in breast milk, lactation. They're white little vessels that you can see with your naked eye to pick up those lipids and carry them into the bloodstream. They also picks up A, E, and K, which are lipid-soluble vitamins. There's one more lipid-soluble vitamin. A, D, E, and K are the 4 lipid-soluble vitamins. They pick it up from right from the blood system, like I just mentioned. The last thing the lymphatic system does is it facilitates the immune response. As we're going to learn here, the lymphatic system includes lymph nodes. Now, you've probably heard of lymph nodes. You've maybe even had swollen lymph nodes. When you're a kid and you get a cold or an earache or a sore throat, you usually have big lymph nodes that appear here in your neck. And the doctor's always feeling for those when you go to see the doctor. As an adult, they don't swell near as much or near so often, but they're still there. In adults, you hear about lymph nodes because lymph nodes are where cancer tends to spread to. Lymph nodes are one of our main ways of fighting cancer, but if enough cancer cells arrive at a lymph node, it sort of overwhelms the lymph node, and then the lymph node itself becomes full of cancer cells. And then filtering this tissue fluid and lymph fluid, which is basically happens in the lymph nodes. The lymph nodes filter this fluid that is picked up by the lymphatic system. So what does it do? Well, it protects us against disease, and that's a good thing. It responds to all of these different things, these environmental pathogens, these bacteria, viruses, and so forth. Makes toxins. It breaks down toxins and picks up toxins. It identifies abnormal body cells. And I've probably said it before, but most of us are forming cancers every day. We have certain cells that mutate in our bodies and turn cancerous on us. But luckily, we have this lymphoid system that recognizes those cells as abnormal and eats them up. And so that's another big role of the lymphoid system. Now, when we get to the third part of the lymphatic system, we're talking about the specific defenses. And these are actual mechanisms that can go in and attack a very specific problem. This is the immune response. That we develop immunity to different things, and then it can those antibodies can then go after and kill it if you're ever exposed to it again. These antibodies are made in a set of cells called the lymphocytes. They were one of the white cells that you studied, looked at when you were looking at blood cells here just a very short time ago. And the fact is, we develop specific lymphocytes for very specific diseases. I'm going to show you a video at the end of the day today entitled "The Common Cold." May not get it done today, maybe do it Monday. But it talks about how we fight off viruses. Immunity is a term that means the ability to resist infection and disease. It actually doesn't just involve the lymphatic system. It involves all the other cells of our body too, enables them to help fight off disease as well. But the primary thing is the lymphocytes, which make the antibodies, which are the specific immunity cells. So, I think we've already discussed this. There's basically 2 categories. One is the nonspecific and the specific. And remember that the nonspecific are the things like the skin and the inflammatory response, inflammation. Specific defenses are these immune things that really help us fight it. Let's talk about the nonspecific things for a minute. Here's the skin. The biggest protection that we have is the fact that our skin is a physical barrier. In other words, things just can't get in through it very easily. Obviously, the skin also has sweat on it, which has some antibiotic effects to it. We have hairs that protect us. We have a layer of secretions up here that protect us. If you ever want to see the biggest tragedy in medicine, I think it's the patient that's severely burned. I think that's the worst trauma that the human body can ever undergo. And when you see people that have a 50, 60, 70% burn, it's just amazing that any of them live. It's so traumatic because suddenly you've completely lost this physical barrier. and now it's just weeping tissue that's exposed to the air, and anything that touches them, any piece of dust that falls on them has got bacteria in it, and burn patients are a mess. And so they require the most intensive of health care ever. It's never a short thing. If they've got big time burns, they have to go through months or more of grafting and things like that. There's new things that are being created now where they can grow skin cells and kind of spray them out on them, which would be a wonderful advance. Anybody worked in a burn center? Anybody seen what they're doing now? I need to go visit one just to see what they're doing these days, because I know it's different than what we were doing. So here's the phagocytes, the cells that we talked about: fixed macrophages, neutrophils, free macrophages, eosinophils, and monos. You notice that lymphocytes are not included there because they're not non-specific, they're very specific. This is the immunologic surveillance that we have. We have these cells in our body called natural killer cells that identify abnormal cells and then kill them. So if you have a cell that mutates and becomes even close to cancerous, your natural killer cells, often called NK cells, by the way, lyse up these abnormal cells. Interferon is a protein. It's found in your blood that helps activate these other cells and helps identify cells that are infected. It's sort of as a general thing. It's non-specific. It helps you fight infection. We used to actually give interferon as a drug, and maybe they still do. I'm not sure. The complement system is another one of these kind of non-specific defenses that is a protein that hooks on to abnormal cells and to abnormal like parasites and buggies, and it just causes them to break up and die. The complement stimulates inflammation as well. But please know that it is non-specific. The inflammatory response is basically caused by the mast cells. You probably remember the mast cells. Well, you probably don't remember them. But way back during early tissues, when we were doing the tissue chapter, there was this stuff called areolar tissue. It was that loose connective tissue that had little elastic fibers, little collagen fibers running through it, and one of the main kind of cells in it were these cells called mast cells, and they secrete drugs that basically just activate your defenses. They actually also secrete heparin, which is a blood thinner, so that you don't go clotting off everything around the area of an injury. So inflammatory response I'll talk more about in just a minute. One of the other things that your body does in order to try to protect itself in a general way is it develops a fever. The body rises in response to most infections, and that is our body's way to fight the fever. We'll talk about that. It's a way to fight the infection. So let's talk for just a minute more about inflammation, called the inflammatory response. It can be triggered by any stimulus. So if you break a bone, you get inflammation around it. If you just get bumped, you get inflammation around it. If you get a bacterial infection or a viral infection, it causes inflammation to occur. This is something you ought to know. The 4 cardinal signs of inflammation, you will see them over and over if you're in healthcare. They're swelling, redness, heat, and pain. And straight from the Latin, that is tumor swelling, tumor. Rubor means it turns red. Calor, like calories, it gets warm. So you can kind of feel with the back of your hand in different areas, and you can feel where it's warm. And pain is called dolor. So tumor, rubor, calor, and dolor are the cardinal signs and symptoms of inflammation. I think the main thing to know about these non-specific defenses that we've been rambling about here is that they can't distinguish one attack from another. They just all happen. They try to fight off things, but they aren't the magic bullet that we'll talk about when we talk about specific immunity. Let's talk about how the lymphoid system is organized, because it is a organ system, and it involves lymphatic vessels. Mainly they're called lymphatics. They're very, very tiny. Honestly, I can say that at surgery I never really saw them. There was a couple of times I saw them. I would see the lacteals in the small intestine. Most of the time when we operated on patients, they had an empty stomach. They hadn't eaten in a number of hours, which is the way you want it, so they don't vomit when they go to sleep. But sometimes you'd operate on people that had just gone to McDonald's and then been in a car accident and then brought up to the hospital, and you ended up operating on them to fix what was broken. And when you did that and you looked at their small intestine, you could hold up a loop of their small intestine, and right there in the mesentery were these little white lines that were about the size of thread, very tiny, but very white, distinctively white. And those were the lacteals that we'll talk about. Those are the tiny lymphatic vessels that are getting the fat out of their intestine and putting it into the lymphatic system. Lymph is a fluid that's very similar to plasma, but yet it doesn't have plasma proteins. In other words, it's fluid that leaked out into the system, into the interstitial fluid, and that extra fluid is picked up by the lymphatics. And if you remember a week or two ago when we were talking about pressures in the capillaries, we said there's hydrostatic pressure that pushes fluid out of the capillaries. There's oncotic pressure that pulls it back in. One of the reasons that there's oncotic pressure pulling it back in is because the plasma outside there, the lymph, the extracellular fluid, does not have proteins in it. So therefore the water wants to get back into the blood vessels. Remember, we had one arrow out, one arrow in, one arrow out, and then we said it didn't pick up all the fluid, and the rest of the fluid we said was picked up by the lymphatics, which we hadn't talked about, but now we're talking about it. So basically these little lymphatic vessels extend from the tip of your toes all the way up to bring this extra fluid and get it back into the venous system. You've all seen people with swelling of their legs. Usually that's because they've had some damage to their lymphatic vessels along the way, and because of that, the extra fluid stays down there. The other cells that make up the lymphoid system include the lymphoid tissues and the lymphoid organs. Now, what are they? Well, lymph nodes, I've already mentioned. The spleen is a big one. The thymus gland, which lives in your chest here, but pretty well is gone by the time you become an adult. And so forth. I did something bad there. And the cells obviously are the lymphocytes, the phagocytes, and other immune system cells, what we're going to talk about. Here's kind of an overview. These are the different organs that are involved in the lymphoid system. The lymphatics, like I said, go all the way to the tips of your toes and bring this extra fluid back up. Up here it runs through a series of lymph nodes in your groin called the inguinal lymph nodes. If you've ever had an infection on one of your toes or on your foot or something like that, you probably noticed here in your groin that you had a bunch of swollen knots. Those are lymph nodes that were reacting to that distal infection. Higher up you have the pelvic lymph nodes. Your appendix is a little organ that doesn't do much for us, but is full of lymphatic tissue. If you look, you'll look at it next term, I guess, under the microscope, and you'll see that it has lots of lymph nodes in the wall and so forth. The bowel, the small intestine, has a lot of lymphoid tissue in the wall of the small intestine. You might say, well, why would you need lymph nodes in the wall of your intestine? Well, that's one of the places where bacteria could get into your system, right through the wall of your intestine. So what better place to have a bunch of lymphoid tissue there to fight it off? we call it MALT, mucosa-associated lymphoid tissue. Kind of a silly name. We have big collections of this lymphoid tissue in the wall of the ileum, a third part of your small intestine, which are called Peyer's patches. And there's these big lymph nodes in the wall, right under the surface of the small intestine. The spleen, all of these lymphatic vessels come together up here in the abdomen, in the lumbar lymph nodes back here, and then they all meet up here at this thing called the cisterna chyli. It's basically a little cistern, which is a water collection point, and then it flows on up here through the chest, up into the, this is called the thoracic duct up here, and then it turns and it dumps right into the junction of the left subclavian artery and the left common carotid artery. That's where the lymphatic system dumps into the venous system to put the lymph back into the venous system, back into the veins. We also have a lot of lymph nodes up here in our neck called the cervical lymph nodes. We also have tonsils. Tonsils are nothing but lymphoid tissue and designed to help us fight infection. And obviously, since you take a lot of bacteria and stuff into your mouth, it's nice to have lymphoid tissue there as well. Can you do fine without them? Yes, you can, especially people that are having troubles with their tonsils ought to have them out. Here's the thymus gland, which lives here in the chest. We would see the thymus gland when we would do median sternotomies and do open heart surgery. By the time you're an adult, the thymus has pretty well been completely replaced with fat, so it's just kind of a little glob of fat there. The thymus does its work for you when you're a child, and indeed in children the thymus can be quite large because it's generating all